Experts have called for calm as the KwaZulu-Natal Health Department manages the outbreak of the disease at more than 10 primary schools and crèches. Health officials say most of the facilities where cases were reported have taps with running water and also practice good hygiene to eliminate the spread of the disease. There are fears that the current disruption of water supply in the eThekwini metro might contribute to a faster spread of the viral infection. However, experts say hand sanitizers are also effective. Health officials say hand, foot and mouth disease affects mostly young children. The contagious viral infection causes flu-like symptoms, mouth sores and blisters on hands and feet, but is usually not serious. Symptoms typically appear between 3 to 6 days of exposure and can last for up to 10 days. Parents are being urged to monitor their children and to keep them at home if they display symptoms.
Most of the schools, the early childhood development centers and the primary schools that are currently affected by this outbreak, they do have the infrastructure to make sure that hands are washed and they keep the hygiene. We even had a session with some of the principals yesterday where we were trying to allay their fears because we could see that they were scared on their side. The calls that the team in eThekwini they were getting from some of the school centers, we then had a session with them yesterday. We fully understand the issues of water shortages around the country, especially eThekwini. So we're saying where parents don't have water, like if you have access to a sanitizer, but just your normal hand washing with water and soap, it will do in terms of making sure that the hands have been cleaned thoroughly.
Parents, children and teachers are encouraged to practice good hygiene by washing hands regularly, cleaning surfaces and preventing children from sharing toys. Schools in Durban have already started screening learners before class and sent out a circular to parents with a fact sheet on which symptoms to look out for.
Hand, foot and mouth disease is not like COVID. I need to clear that one out. It's a very mild disease. But in terms of the how do you then keep yourself clean, the good hygiene. So because even during COVID, we used to stress the washing of hands, making sure that you clean the surfaces regularly.
Experts say those who are living with comorbidities need not panic, but if they have contracted hand, foot and mouth disease, should visit their nearest clinic or doctor.
They can contract, but it's very rare. But if you have an elderly person who has comorbidities, sometimes not common, it's not what we have seen in the current outbreak, they can have a severe disease, but it's not that dangerous. As I've said, it's self-limiting, but if you already have like comorbidities, it means that you need to get medical attention so that your symptoms are managed appropriately.
The health department says hand, foot and mouth disease should not be confused with foot and mouth disease, which affects animals. For SABC News, I am Paulse in Durban.